Hello everyone, I'm Reza Iskandari, a registered psychotherapist, and today I want to talk about something that affects millions of people, ADHD and its common co-occurring mental health disorders, especially under chronic stress. As a therapist working at Better Life Counseling Center, I often meet individuals who come in thinking they just have trouble being constant in their life, only to discover that their struggles are far more layered. When we talk about ADHD, it's important to recognize that it very rarely occurs on its own. In fact, research shows that most individuals with ADHD, children and adults alike, have at least one other co-occurring mental health condition. These are not just overlapping symptoms, but true comorbid disorders that can influence how ADHD presents, is diagnosed, and is treated. So, if you or someone you know struggles with attention, anxiety, depression, or emotional regulation, this talk is for you. Let's dive in. First of all, why does this matter? When someone has both ADHD and another condition, symptoms interact, amplify, mask each other. Diagnoses become more complex. Treatment require customized planning, often involving both sophisticated psychotherapies, but sometimes also medication can be inevitable. That's why I focus on integrative assessments and I try to look beyond symptom checklist. I ask what else is going on? How do these conditions interfere each other's and also reinforce each other? What's really driving the distress? Not, but now let's start with some basics. ADHD or attention deficit hyperactivity disorder is a chronic neurodevelopmental disorder which, although typically begins in childhood, often continues across the lifespan. While it's commonly associated with individuals who are impulsive, hyperactive, or have trouble sitting still, and affects people all ages, the symptoms can present in different and many ways depending on age, gender, and environment. According to the American Psychiatric Association, ADHD is defined by persistent patterns of inattention and or hyperactivity impulsivity that are inconsistent with developmental level, interfere with functioning in social, academic, occupational settings, and have been present for at least 6 months in multiple settings. Three recognized presentations of ADHD are predominantly inattentive, marked by distractibility, forgetfulness, difficulty sustaining attention, and organized stuffs and organizing their minds and organizational struggles. In fact, predominantly hyperactive impulsive type is characterized by excessive fidgeting, restlessness, impulsive decisions, and interrupting others. In fact, this is the type that commonly creates issues in the performance and relationship of adults, their financial crisis, or relationship catastrophes they may experience. And the combined presentation where both inattentive and hyperactive impulsive symptoms are clinically significant. With a deeper look, we need to understand that ADHD is not just a behavioral issue. It's rooted in differences in brain structure, neurochemistry, particularly involving the prefrontal cortex and also dopamine regulation and executive function systems. This explains why people with ADHD struggle with self-regulation, time management, emotional modulation, and task initiation. So, are you a procrastinator? Stay tuned. Importantly, ADHD rarely exists in isolation. In fact, research shows that up to 70% of adults with ADHD, 70%, it's too much, have at least one comorbid psychiatric condition, such as anxiety, such as depression, substance use, personality issues, even learning disabilities, even in cases with autism spectrum disorder also, there are some co-occurring occasions that these disorders have some common ground in their between. These are not simply overlapping symptoms, they are true co-occurring disorders that interact with ADHD and often complicate diagnosis and treatment. For example, anxiety may mask ADHD symptoms through overcompensating behaviors. Depression may be misattributed to low motivation when in fact it stems from executive dysfunction and chronic failure experiences. Substance use also may arise as a maladaptive coping mechanisms for emotional dysregulation and restlessness. Because of these overlaps, many adults are not diagnosed until later in their life, often during an evaluation for another condition such as generalized anxiety or depression. That's why it's crucial for clinicians and clients alike to understand that ADHD is a complex and multifaceted condition, not just an age-related disorder or a matter of poor disciplines. We hear that these individuals are being labeled as poor discipliners, but it's wrong. They have some neurodevelopmental, neurochemical issues in their brain that need to be addressed, and they need to have some resources to actually address their concerns and their issues in their life. Recognizing this opens the door to more effective interventions and long-term management. A closer look at the most common co-occurring disorders reveals us that anxiety, depression, bipolar, substance use, personality, learning disabilities, and autism spectrum disorders frequently occur with ADHD, and each comorbidity alters the clinical presentation, diagnosis, and treatment strategy. Please note that I will try to have a deep dive into anxiety disorder today, and for the rest I will be with you in the next videos that I will upload in next coming days. So when we talk about ADHD, it's essential to recognize that in many cases ADHD is just one part of a larger diagnostic picture. The majority of individuals with ADHD, whether children, adults, or adolescents, experience at least one additional mental health condition, and often more. This co-occurrence significantly influences how ADHD presents, how it is experienced by the individual, and how it should be treated. Let's take a more detailed look at anxiety disorder as the most common co-occurring conditions I would like to talk in detail today. Anxiety is one of the most frequently co-occurring disorder in ADHD, and up to 50% of individuals with ADHD also meet the criteria for an anxiety disorder, which includes generalized anxiety disorder characterized by excessive, uncontrollable worry about various aspects of their life, social anxiety, which presents with fear of being judged or embarrassed in social settings, or panic disorder, which is marked by sudden recurrent panic attacks that is so frustrating for the individuals. In people with ADHD, anxiety can also either exacerbate attention problems or mask ADHD symptoms as individuals overcompensate through perfectionism or hypervigilance. Importantly, untreated anxiety may lead to avoidance behaviors and emotional shutdown, which are sometimes misattributed to inattentiveness or depression, being lazy. As a therapist practicing for years, I find it essential to approach the ADHD just not as a standalone issue, but as part of a broader neurodevelopmental and emotional system. This perspective helps us design more effective, compassionate, and individualized treatment strategies. In my upcoming videos, I will continue this conversation, diving deeper into each of these comorbidities and each of them, and for each of them, I will try to highlight the management and coping strategies that individuals are being interested, and discussing practical therapy tools to manage these dilemmas in the individual they may have in their life. So, if this topic resonates with you, or if you work with clients who are neurodivergent, like this video and subscribe to stay tuned. Please note also that you are not alone in this, and with informed support and meaningful change is absolutely possible.